Hey, good evening, guys. My name is Dr. Nathan Thompson with the Wellness Way Yorkville. Happy Monday. Hope you guys had a great weekend. Welcome to our live that we do every single Monday. Today's going to be fascinating, and it's probably going to be very controversial as well. So I would recommend make sure you watch this video. Make sure you share this video because it might be banned, and it definitely will be shadow banned. So title of today is there an increase in myocarditis? I'll give you the answer. Yes, there is. But we're going to go a little bit further and say, why is there an increase in myocarditis? Why is it affecting more males than females? Why is it affecting athletes? Why is it affecting younger people? And so I'm going to do my best to answer that question. And the reason why I say I'm going to do my best to answer that question is because no one is actually answering that question. They're not trying to answer that question. So today's going to be really interesting, guys. Make sure that you watch this. Make sure, please, that you share this. This may be banned on some of the platforms, but I'm okay with that. All right. So while we wait for some people to jump on live, make sure that if you are joining us right now, make sure that you say hello. Make sure you let me know also where you're watching from, guys. Also, please, please, please make sure you share this video. But while people are jumping on right now, just a couple of things, guys. I know that we always have people reach out to me, say, hey, how do I work with you? How do I work with the Wellness Way Yorkville? And if you are from the Chicagoland area, please get registered for the inflammation event. This is in person, Thursday, August 10th, 6 o'clock p.m. That's the next time that we are going to be accepting new patients. And so with the amount of work that it takes in order to be able to process new patients, especially with all the work we do as far as studying x-rays, past labs, recommending new labs, things like that, we can only take so many at one time. So please make sure that you get to that inflammation talk if you are from the Chicagoland area. And if you aren't from the Chicagoland area, and you want to work with me remotely, we do have some limited availability to be able to do that. What I want you to do is you can go both of these things, go to the top of the page to Linktree. One, you'll see how to register for the in-person inflammation event. You can also register for the webinar as well. And I'll give you an option to watch that right now or to watch it, and you can schedule that out for, I think, every Tuesday. We run that, and it will be a replay. It's not me live every Tuesday. But you'll be able to watch that and be able to schedule the time to be able to watch that. If you go all the way to the end, you'll be able to see the link to be able to go and schedule an initial discovery call with me to figure out what we need to do in order to help, number one, figure out your condition a little bit better, be able to hear from you, talk to you one-on-one, but then also make sure that we are recommended right tests in order to help you get better as well. And if you guys haven't noticed, and we've been slowly putting some things out, but save this date, guys, especially if you're in the Chicagoland area, or actually if you're within Illinois or Wisconsin or Iowa. People have driven that far in order to hear the I Disagree event with Dr. Patrick Flynn. That is, we have secured a venue. Guys, this event is going to have 200 to 300 people at that. 10/24/2023 from 6 o'clock to 9 o'clock. Doors will open at 5 o'clock. Save that date, but we do have the registration that is now live just over the last day or so. And you can go, if you go to the Linktree page, or if you're watching on Facebook, go to the top and you'll see that pinned to the top of the page, and you'll be able to register for that event that is going to be in Yorkville, Illinois. Dr. Patrick, my mentor, who taught me everything that I know, or I say a lot of what I know, and the biggest thing that he has done is instill in me an absolute obsession with becoming clinically better. And he's going to be coming to speak on that day. It's going to be an unbelievable event. This is the first time in about, I think, 2 or 3 years since he's been into Yorkville. So this is going to be an awesome event. Everyone who comes to it, they cannot believe how great a time that they had, even if it is on a Tuesday night. So you can get registered for that or mark that on your calendars. And tickets will sell out for this event. So guys, make sure that you put it on your calendar or already go and get registered for it. So let's ask this question, guys. Is there an increase in myocarditis? The answer is yes. Anyone now who's saying that there isn't is either misinformed or is just flat out lying. I think they call that misinformation and disinformation, right? And I'm going to show you from the experts, they now admit that there is now an increase in myocarditis. So we're going to ask very candid questions. We're going to ask very genuine questions, and we're going to try to answer those questions. The biggest thing that I will say is that I have gotten videos taken down, especially on the YouTube platform, for just asking the questions. And if we can't ask genuine questions, it really is because the answer needs to remain hidden. I want you to think about that. If we can't ask genuine questions, it's because the answer needs to remain hidden. So let's talk about this first. So I went back, looked at some research. This is about a year old. And the question is myocarditis, because a lot of people will say, oh yeah, because it's COVID causes myocarditis. Now here is probably where they're pulling this research article from. So this comes from the Journal Environmental and Public Health, April 2022. Title of it is Myocarditis in Athletes Recovering from COVID-19, a Systematic Review and Meta-Analysis. Meta-analysis is always very good because it reviews research from many other different papers. So in this meta-analysis, here's what they said. In total, there was about 8,000 athletes from 15 studies were included in the analysis. The pooled event rate of myocarditis was 1%, reaching 4% in a subgroup analysis. Basically, what they're saying is they're saying that myocarditis was present in athletes who had had COVID-19 between 1% and 4%. Okay. Now, people are going to look at that and say, see, I told you, there it is right there, that having a natural infection can cause an athlete to have myocarditis. However, if you read this deeper, here is what they say, which is why you shouldn't just read just the summary. You should read the whole thing, because further down, they say, here's some limitations of the study that we performed. Limitation was this: we are also aware that the athletes' vaccinal data were not collected, and that there is a not negligible correlation between COVID-19 vaccines and myocarditis. So interesting enough, they're talking about athletes who have had COVID-19 infection, but what they didn't actually look at was whether they had had the vaccine or not. And they do readily admit that there is a correlation between myocarditis and the COVID-19 vaccine. Okay. So SARS-CoV-2 vaccination of myocarditis or myopericarditis population-based cohort study. So here is what they found as far as their conclusions. Vaccination with mRNA 1273 was associated, now listen to this, with a significantly increased risk of myocarditis or myopericarditis. This was done in a Danish population, primarily driven by an increased risk among individuals aged 12 to 39 years of age. I'm going to give you my opinion as far as why. While the BNT 162b2 vaccination was only associated with a significantly increased risk among women. However, here's what they say. The absolute risk of myocarditis or myopericarditis after SARS-CoV-2 mRNA vaccination was low, even in younger age groups, in which they then said the benefits of SARS-CoV-2 mRNA vaccination should be taken into account when interpreting these findings. So what they say is they say that it's significantly higher, but the absolute risk remains significantly slower. Here's what I found so interesting when it comes to looking at a negative outcome of any kind of therapeutic intervention or a drug or gene therapy, whatever you want to call it, is that they downplay the side effects and they'll say there is a risk, but the absolute risk is very small. But then when they tout the benefits of a medication, they'll say that the absolute how much it absolutely improves, which is what they would call like the relative improvement versus the absolute improvement. Then they will always tout not the absolute improvement, they'll look at the relative improvement. Let me give you an example. When they said patients who take statin drugs have reduced their risk of a heart attack by 33%. No, they don't. That's the relative risk reduction. The reason why, when they looked at the studies, they found that they took 100 people, 100 of them were on statins, 100 people weren't on statins. And then they looked at, out of that group, 3 had a heart attack that weren't on statins, 2 had a heart attack that were on statins. And they look at, well, 3 and a 2, and it's decreasing your risk by about 33%. That's the relative risk reduction. But if you look at the absolute risk reduction, it is actually only 1% over a certain amount of time. So what's interesting, when they talk about negative side effects of any kind of drugs, they talk about absolute risk. But then when they talk about the benefits of drugs, they talk about relative risk. And you see how they talk out of both sides of their mouth. So when they say, yeah, there's an increased risk, but you know what? The benefits far outweigh the risk. And you've heard that for a lot of different medications. You actually have heard that for a lot of other vaccines as well. But here's the problem. In order for them to make that bold statement, you have to perform a proper risk-benefit analysis. Now, in order for you to be able to perform a risk-benefit analysis, number one, especially when you're talking about COVID-19, number one, you need accurate testing. Was the testing accurate? I'm going to show you that at the end. Number two, you also need an accurate cause of death, which I'm going to show you that too. Number three, you need to know what the long-term side effects were, in which they don't know that beyond a certain number of days. And then number four, you need to know the effects of repeated boosters, in which they don't know that as well. But they sure as heck are sure that the benefits far outweigh the risk, which is impossible. That's not a fact. That's an opinion. That's an opinion coming from a professional that really hasn't done a risk-benefit analysis. In fact, you can't do that because all of these things are not necessarily true. Accurate testing, accurate cause of death, long-term side effects, and the repeated effects of repeated boosters. Now, I don't know, guys, if you can hear this or not, okay? But anybody wants to argue, I love arguing. I should have been a lawyer. But you might not be able to hear this, but this is a video that I pulled. This is an interview with Dr. Paul Offit. Now, if you know who Dr. Paul Offit is, he's considered in mainstream media one of the premier vaccine experts. Okay, let me know, guys, if you can hear the audio on this, because I don't have an earpiece in. But they asked him this question. He is considered, in fact, any questions in regards to any kind of vaccine, he's the one that you're usually seeing on any kind of mainstream media news site. And in fact, when I came out with the first video that said, here's blood work pre, after the first, after the second, and here's what I found, they actually went to him and asked that, and without even watching the video, quickly discounted it, saying it just doesn't make any sense or it won't make any kind of difference. But here is what Dr. Paul Offit said in this clip that you might not be able to hear. I got to figure out how to be able to get audio from hearing it through my mic versus, on the broadcast. But what he said is this: there is certainly a causal link between vaccination and myocarditis and pericarditis, no doubt about it, but it's unclear why. So even the foremost expert on vaccines actually does now admit that there is a causal link between a COVID-19 vaccination and myocarditis and pericarditis. Who says so? The expert says so. Yet there are people that are still denying it. Now, this is coming from Dr. Paul Offit, who also said this, and I quote, each infant would have the theoretical capacity to respond to 10,000 vaccines at any one time. And so he said that an infant immunologically could handle 10,000 vaccines given at once. Here's what's interesting is that they said, okay, Dr. Paul, if that is true, then our challenge to you is to take 10,000 vaccines all at once. And he still hasn't come up. He still hasn't taken that bet yet. I wonder why. So he's actually admitted, is there an increase in myocarditis? The answer is yes. It is clear across the board. Yes, we are seeing an increase in that. A lot of them are going to say, but it's not that much. Okay, well, let me say this. Take that over 30 million young adults. That does come to a lot. And in fact, cause it with one person, with one young adult, then that is the world to that mom and dad. So let's go to OpenVAERS, the Vaccine Adverse Event Reporting System. This is linked to VAERS, so Vaccine Adverse Event Reporting System. And here's what they say, because this is well known and it's widely accepted that when you look at the Vaccine Adverse Event Reporting System, this was actually set up by the CDC as a voluntary reporting system for any kind of vaccine adverse event. Now, it's voluntary, meaning if you have an adverse event, they say, well, it's good that you go ahead and report that, but the doctor's not required to, nor is the patient. And in fact, many times, a patient doesn't even know that this reporting system even exists. And because of that, it's voluntary. It's been estimated that about 1% of vaccine injuries are ever reported. Now, depending on what you look at, they say 1% up to 10%. So basically, if you are conservative, you can take these numbers that I'm showing you right here and multiply that by 10. So to date, there has been about 2,500,000 reports of adverse events in general. But if you look at the COVID vaccine adverse event reporting, that comes out to 1,500,000. Now, if it is true that it is at 1%, then that is absolutely detrimental. If you say, well, let's say conservatively that maybe only 10% are actually reported, then that number of adverse events, including a bunch of different things, could very well be at 15 million conservatively. So if you go to the OpenVAERS, which is linked to the Vaccine Adverse Event Reporting System. And if you've ever been to the Vaccine Adverse Event Reporting System and try to navigate that, it's nearly impossible. I think they make it very confusing on person, okay? So if you look at this and you look at the numbers, you look at the statistics, and if you look at the all cases reported to VAERS of myocarditis and pericarditis, what you will actually see is you will see from 2010, and you will see all the way up when you get to 2021, and you will see nearly no cases, and then all the way up to 16,000 in 2021. That's when shortly after they started rolling that out, and you can see it go down in 2022. And you even see, because this has been updated as far as July 15, 2023, and you can see that even lower. So if you look at the spike of myocarditis and reports to VAERS, you're seeing that it absolutely has gone through the roof over the last 2 years. How can you look at these numbers and deny that it isn't happening? Now, why is it actually going down? Well, I can very well give you my opinion, is because people got really smart really fast and said, you know what, I had 1 or 2, but ain't no way I'm going to go past that. I am done with these shenanigans. Now, here is another graph I want to show you. This has to do with age. All myocarditis, pericarditis reported to VAERS, COVID vaccine, versus the flu vaccine. So if you look at what the flu vaccine was doing, that is in the blue. And then if you look at the age of post-vaccine myocarditis, and you can see the spike starting right around 12, going up to 19, 21, and then tapering off, and then they don't measure it past 50 years of age. I want you to pay attention to this, and what I want you to look at is where it spikes at the highest. I want you to ask that question: why does it spike at the highest in in individuals looking at about 18 to 21 years of age? This is actually very important. Okay. Now, interesting enough too, is that you will see that about 60% of the cases are in males. Almost 61% are in males. So a majority of the cases are seeing it in males. They're seeing a higher amount in males than in females. And I want you to pay attention to that, because I'm going to do my best to explain that as well. So if you look at this, yes, you're seeing a massive increase in myocarditis, and it's actually being reported after the vaccine. Even Dr. Paul Offit says, yes, we are seeing it after the vaccine. Yet almost every single healthcare provider is saying, yeah, actually, most of it was actually due to the COVID infection. I'm going to explain to you why that doesn't make any kind of sense. And if they reference that study that I said in the beginning, they actually didn't read the whole article because they didn't even know what their vaccine status was. And so they weren't making any kind of link between the two. So I'm going to answer these questions to you. Why the response? Why the younger age versus older age of people? Why are the majority of them males? And why are they athletes? Let's start to answer these questions. And again, people aren't trying to answer these questions, at least not yet. It's kind of like when we used to give these amalgam fillings that contain mercury, and we realized that they were extremely toxic, especially when they started to off gas as they started to degrade. The longer you had those in, the more that you chewed hot materials, things like that. And as it got older, the more it went off gas. And I remember even talking to Dennis, why are you still using these amalgams? And they're like, because they're better, they're more stable. And then all of a sudden they switched to all of these white composites. And then I asked them, well, why are you using the white composites? Well, because they just, they look better, And so we're not even attempting to ask these questions. This is, considered off limits. That if you see someone, for example, like LeBron James' son, if you see that, you say, no, you can't say anything about that. I'm like, well, I want to know, because if you were the one who was shaming people that they weren't getting it, and you were posting online, that I am better than you because I was getting the vaccine, and you demanded that we have, some kind of vaccination card, or you wanted that to be able to travel or even go into a restaurant, then why can't we come back and say, hey, listen, what was his vaccine status? I would want to know that. I just want to know the truth. And isn't it amazing how, it only works for you as long as you agree with it. So why the response? Why the younger age? Why the majority males? And then why the athletes? So the first thing that I want to do is why the response? Why is it affecting the heart? I've talked about this in our Make Immune System Strong webinar. And in fact, I have that. It's saved. It's downloaded. I believe that you can find it on Rumble. I uploaded it to YouTube. It got taken down in about 15 minutes. You can find it on Rumble. It's about an hour and 15 minutes long. And I think I uploaded it last October. So it would have been about 9 months ago or so, give or take. This is included in this, but I want to touch on this again. This comes from the Journal of Pathology of 2004, almost 20 years ago. The title is Tissue Distribution of ACE2 Protein, the Functional Receptor for SARS Coronavirus, a first step in understanding SARS pathogenesis, okay? Pathology, so the beginning of pathology with the virus. Now, here's what they say. ACE2 mRNA is known to be present in virtually all organs, okay? Now, where it's located mostly is in the oral and nasal mucosa. It's in the nasopharynx, so in through the throat. It's in the lungs. It's in the stomach, the small intestine, the colon, the skin, the lymph nodes, thymus, bone marrow, spleen, liver, kidney, and brain. It's nearly everywhere. Well, what do you mean about this ACE2 expression? What do you mean this? It's a receptor. It's a receptor, angiotensin converting enzyme. And basically, when you look at angiotensin converting enzyme, it is what helps you to control blood pressure and to control sodium and potassium excretion. If you've ever heard of an ACE inhibitor, what that does is that blocks the expression of ACE2. And so that effect will work with the blood vessels, and it will work with the kidneys in order to lower blood pressure. So this angiotensin converting enzyme expression on the cells is literally everywhere inside of the body, but where you have it mixed the most is within the lungs. So where you have this ACE2 expression is really anywhere where you see these green circles. So you see ACE2 expression, these receptors in the brain, in the eyes, in the nasal cavity, oral cavity, the thyroid, the heart and blood vessels, the lungs, the liver, the gallbladder, the kidneys, the stomach, the pancreas, the intestines, the female reproductive system, and the male reproductive system and also on the skin. Now, did you ever hear of a woman having an abnormal menstrual cycle after a COVID vaccine? Have you ever heard of someone breaking out in skin eruptions after a COVID vaccine? I have. Have you ever heard of issues with brain fog after a COVID vaccine? But I want you to pay attention to this right here, the heart and the blood vessels. So let me break it down for you. If you get sick, the primary method, it's a respiratory virus, which means the virus enters through the ACE receptor and is taken in through the ACE receptor into the cell, begins replicating. That virus in a healthy person will stay at the barriers between the lungs and the external and internal environment. Remember, when you look at your immune system puts all of its soldiers around the barriers because it's a lot more advantageous to handle an infection at the barriers away from the organ versus letting it become systemic within the body and to overrun the body. If you were in a war, you would put all your soldiers at the castle wall. You wouldn't let them sit inside of the castle. You would want to protect the perimeter at the castle wall, and the immune system works the same way, which is why most of your immune system is sitting in the lung barrier, the gastrointestinal barrier, the genitourinary barrier, and along the sinus of the nasal pharynx, because when you have an infection, that's where it is supposed to stay. Now, I want you to think of it in a healthy person. They have a lung infection, the immune system handles it, and then you are good to go. But what will you think would happen with this expression within cardiac muscle and blood vessels if you decided to bypass the barrier of the lung and to inject something that is going to cause certain cells to make a spike protein that can then become systemic, having bypassed the barriers? So you have a spike protein that gets taken up by cardiac cell or by the endothelial lining of your arteries. And then all of a sudden, those cells say, I'm infected, puts up a flag, and then the immune system comes in and says, you know what? You don't belong here. We need to get rid of you, and we are going to have an inflammatory response. And now what you see is you see an inflammatory response that's happening within the arteries, and you're having an inflammatory response that's happening in cardiac muscle. So I want you to think of this. Why the response? Because the infectious response is designed to be handled at the barriers away from the organs. But then when you start bypassing the barriers, which we do not only in the COVID-19 vaccine, but in a whole host of other things, then what we do is we cause an abnormal immune system response by bypassing the barriers because your immune system, in order for it to work correctly, it needs to have an inflammatory response at the barriers to then have an antigen presenting cell known as a monocyte or a macrophage, and then be able to prevent it to a helper T cell, which then will go to the B lymphocytes and say, go ahead and make antibodies. And then I want this killer T cell. I want you to go in and start destroying sniper specifically these cells that are infected with a virus. That's the way it's supposed to happen, but it doesn't happen that way when you decide you're going to bypass the barriers, make certain cells a spike factory that's then going to cause an inflammatory reaction with any organ that has ACE expression, which is the cardiac muscle and also with your arterial system. Now, Dr. Nate, why the younger age? Guys, make sure you please share this video. Why the younger age? Well, I want you to think about it. Is it true that younger people have a more robust immune system response? And the answer is yes, they do. It's common that they do, but it is not normal. See, everyone says, as I get older, your immune system is supposed to go down. It's not supposed to go down. It goes down because you have been led in a very bad direction as far as your health. You have been told that it's genetic or it's old age. You have been told that there's nothing that you can do. And as a result, we have a lot of people who are overweight, obese, on high blood pressure medications, who are type 2 diabetic. who are eating statin drugs like they're candy, and the doctor keeps doling it out and doing nothing in order to help you take your life and control of your health back. So obviously, younger people are going to have, in general, a stronger immune system response. And the reason why is because they haven't had that much time in order to beat up their immune systems. So really, when you think about it, you're not seeing the amount of myocarditis in older people because they're having a lower immune system response. This actually shows you that if you looked at the COVID-19 vaccine, I talk more about it in the Make Immune System Strong Again. But when they looked at people who are on immunosuppressants, corticosteroids, or after cancer treatment, anything that destroys the immune system response, they found in those people, you give them vaccine and literally nothing happened. There was not a B lymphocyte response to make antibodies at all, which is why they said, yeah, these people, they need 3, 4, 5, 6 different vaccines in order to just get their antibody levels up to adequate levels. But for a young person who has a strong, robust immune system response, here is what is happening to them. And in fact, what I've said from day one is that if a young person, it wasn't affecting young people at all. Their immune systems were strong enough to handle this without any problems. They didn't tell you that because they never measured a young person's immune system response. They never measured your immune system response, and you can measure an immune system response, but they told you that this virus was mysterious, it was nefarious, you didn't know who it was going to affect, and if you knew physiology, you would know exactly who this was going to affect, who this would affect the most, and who would not have a hard time with it. And it wasn't the younger people. And in fact, they would have been fine. They didn't need anything, but then they gave them something like this. It which just goes to show you their immune systems were strong enough to handle it, but bypass the barrier and produce a massive inflammatory response. Now, here's another question. So we said, is it happening? Yes. Here's how it's happening. Here's another thing that we answer to is, why is it happening in young people? But I'm going to answer this question too, is that why is it happening in more boys than they are in girls? And I want you to look at this right here. I want you to consider hormones. Testosterone, cardiomyopathies, and heart failure, a narrative review. Here's what they say in the Asian Journal of Andrology. And this was 2 years ago. In myocarditis, testosterone directly promotes the type of inflammation that leads to fibrosis, and it influences viremia with virus localization. So isn't that interesting how they link testosterone to inflammation and fibrosis? What do you mean? What is fibrosis? Scar tissue formation. It's what happens when there is injury. You have injury in the arteries, you have plaquing, and then calcification. But the first thing that happens is fibrosis, and it's the body's attempt to repair. Now, the other aspect of it, if you look at a female who's going to have a higher level of estrogens, then you're going to notice, yeah, it is affecting more males than females. That's interesting. So why is that? I want you to think back and look at heart disease. If you look at heart disease, do you ever see a woman have a heart attack at 40 years of age? Now, the only time that they're going to have a cardiovascular event is usually a result of a drug, namely birth control or some kind of upper cervical injury. So you don't see women who are having an active cycle and their estradiol contribution is coming from their ovaries. But what happens is you see them catch up after menopause with cardiovascular incidents as they go into their 50s, 60s, 70s, and 80s. And I always wonder that. Why is that? Is there some kind of protective mechanism with estradiol? Well, if you look at this article that comes from Cancer's research, it says the impact of estrogens and their receptors on immunity and inflammation during infection. Here's what they say. One of the largest determinants of the outcomes of such infections is the host immune system response. There you go. They just said it. It's not the virus, it's the host immune system response. Too weak a response can lead to enhanced spread by the pathogen, while an overstimulated response can lead to immune-induced tissue damage. Recently, it's become widely accepted that estrogens, a class of sex hormones, are capable of dramatically altering the responses of host cells to microbes. And here's their conclusion. Traditionally, the purpose of estrogens and other sex hormones was thought to primarily be the regulation of the development of reproductive organs. It's now apparent, however, that these steroids exert a wide range of effects on other systems. In general, it's been shown that estrogens inhibit an anti-inflammatory effect that is associated with improved outcomes during severe infection and wound healing and repair. So there you go. This is why it affects more males than females. And in fact, this is heart disease over the years, cardiovascular incidence. So you're going to see that men lead and then women catch up once they start. Actually, you see ages 45 to 54, usually 50 to 54 is the age of menopause. And then you see at 55, 64, it equals out at 65 to 74. And then women actually overtake it at 75 years above. So why do you think that happens? This is why a lot of women, when they hit menopause, they like, my joints hurt. I feel so inflamed. I don't know what's going on. Well, how many doctors told you, yeah, your estrogen levels, your overall estrogens are decreasing and it's not being covered up. Your sassy behavior can't be covered up by estrogens. And now you are being exposed to truly where your health actually is. But here's what's really interesting. Why the young males? Is there a link with testosterone? But why are they so young that you're seeing it in young males? And here's what's interesting. This right here is free testosterone, and over here, total testosterone. From 20 to 75 years of age, both of them kind of follow along pretty similarly. But as you look at age 20 to 75, you can see that a male's testosterone levels are at its highest anywhere from about 18 to 21 to 22 years of age and gradually starts to go down. Now, I've talked about this ad nauseum, that it's not supposed to go down that much. Everyone says testosterone is supposed to lower as you get older. No, it goes down because you get more beat up. That's the reason why. Men are biologically programmed to reproduce their whole life. We are not supposed to have lower testosterone, but you see it happen, mainly because men don't work out anymore. They eat a bunch of sugar, they drink a lot of alcohol, and they don't do anything that requires testosterone at all. Watching the Bears game doesn't require any testosterone. So you see that goes down. I want you to look at this, how testosterone is higher, from 18 to 21, 22 years of age. Now watch, let's put both of these graphs together. This is free testosterone, 20 years of age. Here, right here, is the incidence of myocarditis, pericarditis, and you can see that incidence goes down and it follows right along with testosterone. Interesting. So why majority males? You have to ask this question. Does testosterone contribute more while estrogens exert a more protective effect? Now, why is it happening in athletes? So why are we seeing this in athletes? Now, let me ask you a question. What tests do doctors use to diagnose coronary artery disease or heart arrhythmias? And the answer is they do a stress test. They're stressing the heart more than what it needs to be in order to try to induce symptoms. So I want you to think of this. Who stresses their heart the most? Is it athletes? Is it elite athletes? Or is it the general population? Is it the soccer players? Is it the basketball players? Is it the runners who need a tremendous amount of cardiorespiratory endurance? Or is it the general population who spend 8 hours sitting at their desk or 8 hours sitting at school and then going home, staring at their phone or playing Minecraft at night? They're not stressing their heart. Who is the test subjects that are actually doing a stress test to see what's happening after the COVID-19 vaccine? It is the athletes, particularly ones that are involved with any kind of conditioning that demands the heart to beat faster and the heart to beat stronger. Now, I want you to think of this then. How many young people don't even do enough exercise to even stress their heart? Which begs this question, could that mean that the number of cases could actually be higher, but they're just remaining subclinical? Could the actual number of cases be even higher, but we don't know because they remain subclinical because they never stress their heart? That's an interesting question that needs to be answered. Now, was a new article that came in June 2023 in Clinical Infectious Diseases. Remember what I said? You have to do a risk-benefit analysis. In order to do that, you first have to even just diagnose things correctly. So this comes from Clinical Infectious Disease, and it was called Maintain the Utility of COVID-19 Pandemic Severity Surveillance, Evaluation of Trends in Attributable Deaths, and Development and Validation of Measurement Tools. A whole bunch of words that actually says this. As when we look back at the data, we actually found that the people who tested positive within the 30 days that died, we over-reported that they truly died of COVID-19. Here's the results. Among vaccinated VA patients, they did these in two different healthcare settings. One of them was the VA, that died within 30 days after a positive test from January to February 2022. Death was COVID-19 related in only 70% of the cases. In June to August 2022, death from COVID related was 47% of the cases. So those that were attributed as a COVID death, when they went back and looked at it, they said, actually, it wasn't. Yet we still continue to watch the ticker tape on CNN, on Fox News, and we said that the amount of deaths that they were broadcasting was set in stone, that was 100% accurate. And here's their conclusion from Clinical Infectious Disease. By mid-2022, death within 30 days did not provide an accurate estimate of COVID-19 related deaths in two separate U.S. healthcare systems with routine admission screening. Remember how they said if they tested positive and they died, it was automatically a COVID death? This is what the results found, was that it was in their healthcare systems, in the VA, it was 33 to 50% over-reported. Could you imagine that if 50% of the deaths were over-reported and they actually didn't die from COVID, they died from something else? And we all know that someone went into the hospital with an auto accident, they tested positive for COVID, and they end up dying from the auto accident, but just because they had some RNA, some DNA from a virus that may or may not have been COVID, that they had to magnify 40 times, that was considered a COVID death. Oh, and you know why? Because the hospital got paid more for it. Could you believe that? So the question is, it was 33 to 50% over-reported. So now we have a problem with diagnosis. We have a problem with the solution. We have a problem with the testing. We have the whole problem with all of these different things. And yet we're still not allowed to ask the question. But the question that you always have to ask comes down to this. Why is it? Why is it that two people can be exposed to the same virus, one is fine and one dies? Because are there people who truly died? Absolutely. But if you would go in and you would measure their immune system, you would know exactly where they stood. Here's an individual who came in. This is a CD8, CD4 natural killer cell, CD56 B lymphocyte testing that doctors will never run. Please don't ask your doctor to do it. They will not do it. They will look at you like you have a third eye. Why? There's nothing that they can do in order to improve your immune system response, to try to increase in immune system response. This individual, you can see that he had basically very low CD8 cells, which are responsible for handling cancer cells and a viral infection. You can see when you looked at the numbers, this was after about 3 to 4 months, you can see that all of those numbers started to go back up. What does that mean? That means that his immune system was stronger. Everybody talks about things that you can do to boost the immune system. You can't boost the immune system. You can get it to sufficiency, and sufficiency is enough. But you can see over the course of about 4 months how his immune system improved. And I know you're going to ask, what did he do? He did a lot of things. And in fact, he improved his diet. He improved his exercise. Yes, he was taking some things in order to help with stem cell production. He was taking things like astragalus, echinacea. He was taking medicinal mushrooms, anything in order to improve his response to be able to handle a cancer cell or any viral infection. And now he's stronger because of it. And you know what else has happened to him? He's lost about 100 pounds on top of that. And we were the ones that inspired him and gave him the direction to be able to do that. So I want you to think of this, guys. They were wrong about a lot of things, including the susceptibility, about your susceptibility to a virus, about the number of deaths from the virus. And then now they've also have been wrong about the solution. And yet we still run back and we keep giving them a second chance. Somebody really smart told me this. You know what's interesting is that the only two professions that can be repeatedly wrong and people still trust them are medical doctors and the weathermen. Because we have been taught to trust and to never ask questions. It's time that we start asking questions. And it's also time that we start demanding answers, because it's okay to ask questions. But my question is this: what else were they wrong about? A lot of people come up and say, from what I've seen over the last 3 years, I'm beginning to question a lot of other things as well. And it's becoming apparent that the system that we're in right now, the emperor does not wear clothes. I want you to think of this. When you tear out a man's tongue, you're not proving him a liar. You're only telling the world that you fear what he might say. And that's why if this video gets taken down, if this video gets banned, it just goes to show you that it's not misinformation. It's not disinformation. It's because you truly fear what he might continue to say. So guys, please share this video. And also, if you are watching this all the way to the end, thank you very much for doing that. And if you are from the Chicagoland area, please get to the inflammation talk. Guys, if you are dealing with problems with weight loss resistance, if you're dealing with infertility, thyroid issues, chronic arthritis, chronic pain, type 2 diabetes, autoimmune conditions, hormone issues, please get to that inflammation event, because it'll help you to understand where you start first and foremost. So many people, they start off 17 steps ahead, which is why they never get any better. And if you are from the contiguous 48 states and you want to work with me remotely, go to the webinar at the top on Linktree, or you'll see a pin to the top of the page and you will see inflammation webinar. Please watch that. And at the end, you'll see a link in order to schedule a discovery call with me. So please make sure that you do it. I know that people reach out and they ask me every single day. And remember, guys, to save the date. If you are from Wisconsin, if you are from Illinois, if you're from Indiana, if you are from Iowa, please, please, please get to the Chicagoland area, October 24th, 2023. Dr. Patrick Flynn, who will be coming, and he's going to be doing the I Disagree event. This is this is a life-changing event. I promise you that. And it's going to be an awesome, awesome event. You'll be able to meet Dr. Patrick Flynn. You'll be able to meet myself. You'll be able to meet our wonderful, wonderful staff. It will be an awesome event. You can go. You can already register for it. If you're not ready to register for it, the tickets are gone when they are gone. But please make sure you save the date. I can't wait to see so many people, so many of you that watch at that event. So is there, guys, an increase in myocarditis? The answer is yes. Now I just explained to you, here's what I believe. Here's my opinion as far as why it's happening in men, why it's happening in younger men, why it's happening specifically at the heart, why it's will continue to happen if we don't continue to ask the questions and demand answers. So guys, I appreciate you listening all the way to the end. I hope you have a great rest of your night. I hope you have a great rest of your week. Be well, be blessed. Please share this video. Remember who you are.